get started. Good Okay, thank you for joining us at the September meeting of the Lens Neighborhood Livability Association. And just wanted to announce that this is going to be our last regular meeting for this year. We're going to Char's going to take a little time off, so she's going to take a minute off.
I'm going to go pick up more trash.
Pick up more trash. And we've sent out an email about our December potluck, and instead of a potluck, I think we're going to meet at a local restaurant for a change. And if it's something you're interested in, please contact us, and we're working at finalizing details. Before we get started, I'd like to remind everybody, please silence your cell phones out of respect for our speakers. And one last announcement is VFW, as we've missed out for many months, and they're finally back and up and running. And this Sunday, they'll have breakfast at 9 a.m. And it's a good way to support the VFW auxiliary, and we go there kind of use it as a little clubhouse for our group. So anyone who wants to go there, you're welcome to come. And with that, I'll turn it over to our guest speakers. Our first guest speaker is John VanHoute with Multnomah County Corrections.
Want to go up there or just stand here? What do you guys prefer?
Up front
here?
Great.
Okay. Hi everybody, my name is John VanHoute. I'm a sergeant with the Multnomah County Sheriff's Office in our Corrections Division. I currently manage our pretrial supervision unit called Close Street. And I'm also our West End Vice President for our Corrections Deputy Association. So we kind of do things a little bit differently. We've got a president, which was going to be here tonight, but kids being kids, they brought home all kinds of sickness and she had to take the day off. So she called up and said, hey, can you show up? Here you go. So you're stuck with me. But we have a president, we have an executive vice president, and then we have two vice presidents, one for each side of the river, because we have multiple facilities. Anything with corrections deputies on the east side of the river is managed by the east vice president. Everything on the west side of the river is handled by the west vice president. So that's me.
So John, is there a card there on that little?
Well, yes, there is.
That was what I sent the president.
Okay.
So can you answer any of those?
Well, I can take a stab at it, but
okay.
I'm not going to say they're going to be lengthy answers.
Okay.
So, question one is: as the union president for the Deputies Association, do you have any authority to implement procedures to make sure that the ordinance of the city are enforced? Jurisdictional things being jurisdictional things, there's not a lot that we can say about how things are enforced within the city. City police.
Well, they make the ordinances, but can you follow through with those ordinances?
So our enforcement deputies, which is a different union, those police officers in the state of Oregon enforce any laws within the state of Oregon.
Okay.
So as far as them enforcing it, sure. As far as the union being able to have any authority to implement procedures, no. We review procedures, we might suggest procedures, but there's a whole process for any policy or procedure going in place for both corrections and enforcement. And it's kind of lengthy. It also goes through a stakeholder review process where we take input from not just our command staff members, but the community in general is invited to comment and take a look at policies that we want to put in place. And then it goes through a union review to make sure there's no labor law issues or concerns. And then after all of those things, then they'll implement it.
Do you guys look at ordinances as laws then, or how?
Well, I mean, they are not being a lawyer, I can't tell you the exact definition of an ordinance, but an ordinance is a localized law, very local. So, you have the federal laws, you have the state laws, you have the county ordinances, then you have the city ordinances, and each one is kind of refined closer and closer and closer. So the smallest jurisdictionally would be the city ordinances because it applies to the city in which that's encompassed.
Kind of like the sheriff, Multnomah County Sheriff, wouldn't enforce originally the city ordinance about the camping ban.
Correct, because that's gonna be jurisdictionally what'll happen is, if one of you calls in a complaint, they sort it by jurisdiction, and then they dispatch the appropriate person. It's not that a county sheriff's deputy can't go in and enforce an ordinance if they show up and there's an ordinance violation or something. It's not that they can't charge for it or enforce it, but generally, we wouldn't even show up unless there's a need for us. So, because it would be jurisdictionally sorted to go to the police bureau, and within Portland, it'd be sorted even further into the precinct that covers that area.
Okay.
So.
Not that this is confusing or anything.
Oh, I've been doing this for 25 years, and there's still stuff where it's like, oh, well, that's interesting. But if I wasn't still learning, I probably wouldn't be useful. So, let's see. Any other parts to question one that needs addressing?
What part of the enforcement can you enforce on the camping ban?
So they have very specific crews that go out in a very specific process. So truthfully, you probably don't want us to show up to try to enforce it, because there's specific things that have to happen with the camping piece before they can enforce it, right? So they've put in place practices, and please forgive me if I miss one or more of them. I don't get very many people that camp out in the jail, so I don't necessarily enforce that. And it's kind of hard to pitch a tent on our jail property, so although we do have some people that sleep on there. But there's very specific pieces as far as how many times they have to be contacted and offered services, including tiny homes or other housing, transitional housing type pieces. There's so many contacts that have to happen before they'll actually schedule it. And even if they're going to go out and enforce it, then that's when they call people. Like in my unit, I have corrections counselors that are specialized in linking people up to services and things like that, so that if they are going to go and enforce and remove somebody and arrest them for that ordinance violation, then they give us the heads up, hey, we're doing a mission, we're going to be in this area, we expect to be offering them that last chance to vacate, and understand they have to go at least a mile away. And then if they don't, they'll take them into custody, and then my staff, well, some are my staff, some are another unit staff, but they'll go down as counselors and see if they can connect them to services when and if they are released. So, does that answer that okay for you? I mean, it's not a perfect answer, and I don't know that piece. But ultimately, can a county sheriff's deputy enforce a city ordinance? Yes. But we're not necessarily super knowledgeable about those processes, so oftentimes our enforcement staff won't. We'll call the folks that know.
It's gotten better, but there are people that just go around the block and then they're there for another month. And so we're trying to figure out how these individuals are they, if they're refusing, how that's being tracked. I mean, it just seems like that there are a good majority of people that are just going around the corner and then staying for another month.
Sure, and there are growing pains with every process. This is a pretty new, the whole piece, just like you saw probably on the news, where initially the sheriff refused to book a person on that ordinance and then has reversed course on that. So there's growing pains as we learn these processes and start to understand, you know, our interwoven responsibilities when it goes to that.
Thank you.
Anybody else? All right, question 2. What authority does the sheriff department have within the city of Portland? It's just like any other police officer. However, we're not necessarily specialized in every ordinance that happens there. There's especially those deputies that's within the district. For example, we call it the County 10 car, but that's a very old term. That's one of the districts that included the Justice Center area. But the deputy that's assigned in the area that is also within the downtown area, they might be much more familiar with the ordinances related to the city of Portland, whereas, you know, our deputies that go far East County that are assigned out there all the time, you could ask them about a particular ordinance and they're going to give you the same look that I would. Oh, that's an ordinance. Okay. When I was in my previous life, when I was a reserve officer in a smaller community, we had a city ordinance book, and that got updated every time they would implement new city ordinances and things like that. And we were constantly having to look at it and review it to enforce those city ordinances. So, and that was in a small town. I can only imagine the volume that they have for Portland. So there's intricacies that make it difficult when it comes to city ordinances. When it comes to the more globalized charges that might happen within the city. A police officer in the state of Oregon can take enforcement action anywhere within the state of Oregon. It does. Portland Police's line of authority does not end at the city limits. If you have a violent person that has committed, say, murder, attempted murder, or one of those greater charges, they aren't going to turn the lights off and not go enforce something just because it goes into Gresham. They're gonna take care of it. And it's the same thing with the county. Same thing with the state. We always joke with the state police saying they're just gonna go back to the freeway.
Uh-huh.
But they can enforce the same laws, traffic or criminal, anywhere in the state. Any questions on that one? I told you I was gonna be brief.
Good job.
Well, thank you. Third question is, how does the sheriff department share jurisdiction with the Portland Police Department? Well, it's kind of like what I talked about, where much like laws, you have the global laws, right? Federal law is the law of the land. Then you get to Oregon state law. Well, that's refined to here. And then you get to county ordinances, which is refined further down to the county, and then city ordinances, which is refined further down to the city. So as far as jurisdiction within and shared responsibilities within Portland, it's common for them to interact as far as providing cover for one another and things of that nature. But there's not. We used to call it poaching back when I did a lot of patrolling, right? It wasn't such, not like the hunting part, but it's one of those things where it's like, all right, I got this. This is my jurisdiction, right? And so we try not to step into other people's jurisdiction, certainly unless there's a need to do so because of safety of a person. Even as a corrections sergeant, the sheriff has authorized me. I work in a jail. But if one of you are being attacked and I need to take action because of your safety and the safety of others, I can take that action, right? And I'm working under the authority of the sheriff. So it's, we aren't going to let somebody, that looks painful, you getting beat up, but that's the county line, I'm not going there. So we tend to work well with our partnering agencies, be it Portland Police, Gresham Police. We took over Fairview and took Troutdale for police services, but even when they had those police agents, we worked well together. It's not a jurisdictional bout. We joke about who's writing the report, and so we'll try to give that to whoever's jurisdiction it is, right? We used to joke about, because Portland Police has so many officers, that if we had something happening out on the street, we'd call for cover, there'd be a blue wave, and then they'd all be gone, and we'd be dealing with the person that was handcuffed on the ground and nobody else to give the report to or get reports from. So it was like, where'd they all go? So, but we tend to work well, and so that's how I'd say we share is we share in the protection of the community, we share in providing coverage for each other, and not so much in these bigger towns where you're never struggling for coverage. In the small city that I worked as a reserve officer in, if we had a lot of sickness and things like that, the county would actually come in, and occasionally the state would actually come in and take our jurisdictions. So we don't have a lot of that. Our agencies are fairly large around here, but we work together to provide assistance, certainly as needed.
So I've heard a rumor, and I don't know if it's true. This coming election, you will be working with the Portland Police for any kind of fracas that goes on downtown?
As far as like the protest activity type of things? So as you know, and well, I am a part of our emergency teams. It's the corrections emergency teams that provides assistance as needed. But as you know, that was utter chaos downtown, and there were some very bad days on things that happened. We don't want that again. I remember before I went into Close Street, I was the OIC or officer in charge of MCDC, and literally watched people wheel a dumpster up to my building and set it on fire. Trying to set thank God it's concrete, but trying to set the building on fire. I've watched them put road flares under the wood that's at the portico trying to catch us on fire. So there's a lot of stress on both sides of the event, right? Things get charged. The community often is the one that suffers because of the property damage, things like that, but there's stresses involved with everybody. So we're trying to plan for that.
Okay.
You know, we're trying to account for, and I can speak specifically for my building, we're trying to account for how to get my employees in and out of the jail safely without having to shut down the whole area, right? So how can we do that? We're trying to look at how can we fortify it so we don't have somebody breaking into a jail and setting it on fire like they did on that one night. It's just a terrible. So what we're trying to do is figure out where we can make ourselves and the city as a whole not desirable for the kind of actions that took place, right? If we don't present as a good target to be the focus of that type of attention, then they tend to get bored pretty easily and move on to other things or disperse. And so that was one of the lessons that we learned from that long time period was once we got boarded up, once we didn't catch fire, once we didn't do all these things, they wanted to move elsewhere. So now the planning as far as the sheriff's office is concerned is how can we make our county buildings boring, and how can we also make sure that all of our staff isn't in one area leaving another area vulnerable to whatever shenanigans, if you will, might be out there. So very early in the plannings, I know that as far as working with Portland Police, yes. I mean, truth be told, the first people in the building when they set my building on fire for enforcement type action was Portland Police. Now they share the building, so they don't want to burn down either, but that's the first person in there. So a number of people, including my son who had just started working there, were focused on getting the folks out of the fire, out of tear gas and stuff like that. So Portland was able to deploy into our building to do that.
So what munitions can you use when you have these interactions?
Well, so
Because you've
I'm
got
a different
everything.
anomaly
Okay.
because within the jail, I have to protect not just me and my staff. I have to protect the people that can't protect themselves
Right.
because they're locked into a cell.
Right.
So at some point, unfortunately, there is a point of no return where some activity could jeopardize the life of the folks that we have in the building. So I have a different,
Okay.
depending on where they get to,
Mhm.
that could very dramatically change what happens within my building that I work at and might deploy at as part of our specialty teams. That being said, you know, as you may or may not know, there's been legislation about when you can or can't use certain types of munition. So those are things that we've had to revamp over the years. So it's not just a wing it, here we go, try to figure it out as we go along. We know there are very specific criteria to different variety of less lethal munitions or not chemical sprays, but like tear gas and things like that. There is a much higher threshold to where you can
You can
employ
use those.
certain munitions or tactics and things like that. So, and part of that's driven by legislation. Part of that's driven by lessons learned. I mean, the good news is we've learned a lot of lessons from that. It was an ugly event, and it brought many lessons to us.
Fire hose.
Well, there might be jokes about that, but the odds of that actually coming in with a giant fire truck or water truck that's going to blast somebody off the street, I haven't seen us getting any fire trucks from the
I know.
sheriff's office. But yeah, sometimes there's creative ways. You know, I do know that when we were working on some of the protest details, they would have some of the police intel folks actually making contact with groups, trying to gather intel as far as what they intend to do and how we can keep people safer. So we've been taught over the years and still hold very clearly that your ability to communicate is your best tool, right? I'm proud to be able to say that in a 25-year career working in the sheriff's office in a wide variety of environments and with some people that really don't like me, I've been involved in very few uses of force because of those communication skills. I answered all those questions. What kind of questions do you have for me?
How many deputy sheriffs are there?
On the enforcement side, I want to say there's between deputy sergeants and command staff, I think there's about 150, 170, don't quote me on that. It's kind of a moving target. But I think fully staffed on the enforcement side is about 150, 170. Fully staffed on the corrections side, we have 376 corrections deputies and just under 50 corrections sergeants, and then several command staff members. Yes, sir.
Do you know if Multnomah County Sheriff or City Portland Police Bureau still consider Antifa a tangible threat?
So
I've heard they've kind of run out of steam, but I was just wondering where.
So there's always a concern about any threat, right? So Antifa is known for causing issues and disturbances that can turn badly, right? So I'm not going to say we're ignoring them. That's not true. I'm not going to say that if we hear Antifa's involved in protest activity, or people that are, the term is blocked out, show up on site where there's a bunch of people preparing to protest, I'm not going to say that doesn't give us a bunch of bells going off. But the good thing we learned was as the activity went on during that protest season, if you will, Antifa became less and less interested in participating in those events.
Which is just as good.
If those get deterred and we don't have any more of that,
Yeah.
great. If I can look at a crowd that's standing outside the Justice Center and none of them are using umbrellas to block activity and dressed in black, I'm a happy person, right? So, as are a great many people that show up there. What else?
Do you guys have enough deputies and people in the jails, employees, and then also, do you guys have any concerns with budget? Are your budgets getting cut? Are your budgets being met?
Budgets are always getting cut, and we're nowhere near fully staffed, right? So when I first got hired at the sheriff's office, I was corrections deputy number 454. And like I said, we're funded for 376. I think we have 335 people working for us. So those of you that want a good job, I am happy to put you in touch with our HR folks. Come work for us. We have great benefits, good pay, and a fantastic union. But no, I mean, there's always a need for funding. We currently have several dorms inside our Inverness jail that are not being utilized. In corrections, every dollar goes towards supporting jail beds, right? So be it from the bed itself, to the electricity, to the water, to the deputy, to the counselors, the programs, all the way up to ultimately even the sheriff that oversees us, right? So every dollar is tied to that. So the dollars continue to shrink because of budget restrictions, and that's a low-hanging fruit, right? If you want to take money, how do you cut things? Well, you start taking program offers away and not funding them, which ultimately reduces our budget. So an example I can give you, I've had a very fortunate career. I've worked in many units, including our training unit, and headed that up for a number of years, both as a deputy and as a sergeant. And training is the low-hanging fruit, right? I know that when I was still in charge of the training unit, it cost somewhere in around $200,000 to run one qualification period for all the deputies in the agency. If I want to make up $200,000, what do? I cut that training. But who pays for that, right? Potentially, worst case scenario, the deputy with their life because they don't have the enough training to successfully do that. Potentially, the public, a less trained deputy could potentially respond differently than a well-trained deputy, right? Not just in firearms, but any training, right? I just use that because as the range master, I know those numbers. So the low-hanging fruit gets cut, but there are still mandatory things like DPSST, Department of Public Safety Standards and Training, who are the certifying entities. They require a certain number of hours of training just to maintain our certification. Well, if training hours get cut, we start cutting that down and down and down and down and down and down. But at some point we have to do the minimums, which means we have to take from another place. So we always are singing the budget woes. Do we need more staff? Absolutely, right?
Well, you said, when did you start with Multnomah County?
1999.
Okay. So in the last, let's say, 5 years, what was your employment count? What is it today? What was your budget and what is it today?
You know, I'm a spending guy, right? So as far as knowing what the actual budget is, other than what I had when I was in the training unit, I couldn't tell you. I know it's always been somewhere around 160, 170, 190 something $million. My budget was way more, even though I thought I deserved more for the unit. But staffing has always kind of varied, and the funding has always kind of varied. And you know, while funding goes up, our expenses go up, right? So one of the things I know that goes on people's mind is why are corrections deputies and corrections sergeants and enforcement deputies and enforcement sergeants, why do they get these big raises? Why do they make what they make? Well, it's because they're doing a job nobody else wants to do, right? And it's because how do I attract the best people to be in that unit? So as a guy that goes out and recruits, what do you think the first question people ask me is?
What do you pay?
I mean, you get some people are like, wow, where do you get that cool equipment? But most people are like, what do you make? And then the question that they ask of the next person down the hall is, what do you make? So when I'm involved in contract negotiations, I'm looking to be able to be competitive to gather these folks. If I lose a corrections deputy that could have been going to Multnomah County to a much smaller county when it used to go the other way, but to a much smaller county that makes comparable wages, then something's wrong in that equation. So we make good money, yes. We also endure things, and I won't gross anybody out because you just had food, but we endure things that you never thought a person in corrections or enforcement would ever work. You know, I know of a deputy during the protest season that had an improvised explosive. It was a firework that was infused with shrapnel and stuff like that, go off feet from him, and the resulting loss of hearing and injuries, as well as mental trauma from that, he no longer works for us, right? It's not normal to have explosives go off next to your head at a protest, right? Or when you're walking around our foyer. It's not normal to have people throw bodily fluids on you as just a way to humiliate you or get you because that's all they can do. Those things aren't normal. Walking through that type of stuff on the floor, dealing with people that sadly sometimes are very, very mentally ill, but you still have to deal with the situation. Those are things that when I got started, wasn't in the equation. I was into booking people and running a module, and that's all I had to do. When I was a reserve officer, I had to worry about, you know, traffic stops, DUIs, and responding to calls for service. Now they're doing way more than it was 25 years ago. Yes, ma'am.
So with the influx of extremely violent crime, that the numbers have quadrupled in the last couple of years. As far as corrections and what you're seeing on your are you getting a lot of that particular group, and are they aggressive towards your officers?
Absolutely.
In the same way that they're aggressive towards our neighbors?
Yes, and unfortunately sometimes even more.
Yeah.
Because
My aunt
that's
was
the
a
nature.
district, so
Huh?
I get it.
Do what?
My aunt worked at the state pen.
So she gets that.
She got beat up.
What you're, I mean, I'm sorry. What you're seeing, unfortunately, so as we lose beds, the sheriff will change our booking criteria, or they have to choose what's going to be kept in custody, right?
Mm-hmm.
So, you know, while years ago you might have kept property crimes in custody, that's not what you're getting, right? You're getting the violent folks. So the people, when I first hired, we had 5 jails. We had maximum security all the way down to a restitution work center that our folks that were in custody could go out, find work, prepare themselves for reintegrating in the community, but it was based on behavior and eligibility. Whereas now, the people that I used to have in we called it close custody. So the people that weren't necessarily going to be on disciplinary status for a long time, but they weren't people you would you would really want to spend a lot of time with. Those folks that go in and out of disciplinary units, they're now out at Inverness Jail, which is one of our medium security facilities that used to be best behavior folks. And they're considered good AICs, or adults in custody, right? The folks that are staying at MCDC, you asked about assaults on staff. It is rare to go a week without one of my staff members going to the hospital because of an assault, right? When you condense the population down and don't have stabilizing entities, so some of the folks that, because, I mean, let's face it, not everybody that comes to jail is a hardened criminal. Some people come to jail because they've committed a crime through a mistake or whatever, but they're in custody. Those are what I like to refer to as stabilizers. They're the folks that when somebody goes and attacks my deputy, they rush in and defend them, right? They have a compass. Sometimes it breaks, right? Sometimes life puts them a hand that causes them to go down a wrong path. But the folks that are assaulting my staff, they're the ones that don't care. Mm-hmm. They're the ones that wait until you're going to give them their food and try to drag you through the food port to assault you. They're the ones that will carry shanks and try to stab you. They're the ones that will throw feces on you just to laugh at you. Those type of things. So, you know, we have a mixture, but we've condensed, and those folks that used to be stabilizers that helped to ensure a sense of conscience and morality among the folks in custody, because we tend to follow examples. Those folks aren't there. So we're getting the folks that murder, you know, those type of things at a greater rate. And especially at MCDC, we're getting assault rates where I've got some staff that it's ended their career. I've got some staff that have been off for 2 years trying to recover and may never come back. And some of those are also work stresses from even the protest activity, where, not to beat on a bad drum, but it's hard to imagine what it's like to wade your way through people that want to hurt you to get to work, and then they know your shift and when it ends. So they show up with huge speakers playing Darth Vader's march, knowing you're going to walk through the door to them throwing stuff, yelling at you and things like that. Or have to push out with a special team to create a barrier so they can safely get across the street. So those stresses are a lot, and they take their toll. So, in the end, do we have enough staff? No. 25 years later, do I think it's a good career? Yes. It's good enough that I have now 2 of my sons that work there. A third son started out there and went out to the road. My daughter-in-law works there, and my youngest son was just sworn as a corrections deputy. Do I recommend people to work there? Yes. Do I worry for their safety as they learn this? Absolutely. As a sergeant in there, I worry about them a lot. So, yes, sir.
It's kind of a difficult question to ask. I'll see if I can do so coherently so I understand what I mean. Of the people that you have incarcerated that are violent and dangerous, if you can give me kind of a percentile, what percentage are on drugs or the behavior is influenced by drugs? What percentage are mentally ill, psychotic, schizophrenic, whatever? And what percentage are just plain freaking evil criminals?
So,
if you understand where I'm going.
I get where you're at. So, this is going to be a best guess. Don't quote me. Statistics like that, the communications unit is way better at gathering that information.
But your boots on the ground.
And boots on the ground. And those numbers tend to be going up, right? So as far as how many people are drug affected, more and more. And drugs are coming into the jail, not to create new imaginations, but through creative ways, drugs come into the jail. And now we're faced with the fact that most drugs are now laced with some form of fentanyl, if not fentanyl itself. And, you know, not that it's a surprise, but there are no quality control standards for the folks that are manufacturing drugs. So a fentanyl pill that might be perfectly fine and give you the high that you're looking for, with one pill, the very next pill could kill you because it's pure fentanyl, right? It takes very little fentanyl. And then when you talk about how they pass that around, and suddenly that's where you end up with the folks that are overdosing, need to be Narcan, and sometimes dying, right? So the drug affected, that number's growing and growing. as far as mentally ill, for years we've always said that our population, 75%-ish of our population, sometimes more, suffers from some form of mental illness. Not the super extreme time all the time, but we have some of those too. We have a specialty unit within MCDC and it only has 10 cells, but that's where the people that are the most severely mentally ill, that should probably be at the state hospital are housed, but the state hospital also has no room in there, right? So it's kind of a wicked cycling problem, and sometimes that goes up, sometimes that goes down as far as numbers and ratios. Your violent, want to kill you type folks, if I had to put a number at it, and I am solely guessing, it's probably under 20%, right? Probably far under 20%. It seems like a lot, because if you have one incident of that happening, it seems like the whole world is against you, right? If you get attacked, you think that all 32 or up to 75 inmates in that area are out to get you, when that's not actually true. It just feels like it. So gut reaction, maybe as much as 20%, certainly more likely under that a little bit, but that also is going to vary, right? It seems like there's influences that happen. So
Thank you.
yeah.
And thank you for what you do.
Yeah,
Get our other folks
yes,
out.
we do.
Yeah, I'm sorry.
I'm giving you the hook. Thank you for your service.
Of course. Yeah, Mark.
Hey, you guys are up.
Yep, you guys are up.
Well, thank y'all for inviting us to come speak. Thank you, John, for your service. And so John works at MCDC, like you said, and the 3 jails in Multnomah County are one. The corrections health from the health department is one of the 5 divisions that we're going to talk about tonight. But first, we'll introduce ourselves, and we'll tell you a little bit about how the health department is structured and some of the work we're doing in the community for improving the health of everybody who lives here in Multnomah County. Charlene, you're first.
So good evening, my name is Charlene McGee and I work as Multnomah County's Director for Prevention and Health Promotion within the Health Department in the Public Health Division.
And good evening, everyone. My name is Anthony Jordan. I'm a Senior Manager in Behavioral Health. I'm the Addiction and Prevention Manager.
And my name is Bruno. I'm the Health Officer for the county. I'm a family medicine and preventive medicine doctor, and I work on public health interventions throughout the county. And I'm in the Health Officer Division. So if you've been doing your math, Corrections Health that works alongside John is one of our divisions. Charlene's in Public Health Division. Anthony's in Behavioral Health Division. We have a clinical division called Integrated Clinical Services that has 17 clinics. 9 of those are student health centers. 7 are primary care clinics in the county. And then we have an HIV clinic. And then the 5th is the Health Officer Division. And so in my division, so I oversee the emergency medical services system, all the ambulances. I oversee the medical examiner's office that does death investigations. I oversee the public health emergency preparedness, preparing for catastrophes and disasters in the area. And then I also work on a lot of opioid work as well, and fentanyl. So we can kind of talk about some of the work we're doing in the county. We can tell you about some of the work we're doing, especially around folks who are struggling with mental illness and substance use disorder. And we can talk a little bit about some of the plans that we have kind of going forward, some of the big projects we're working on. And we can go through your questions as well, although we may speak a little off the cuff too, if that's okay.
That's quite all right. Yeah, we just need a better understanding of what you do, how you can help the community,
Yes. Yeah, thanks,
how to
Sharon.
get in touch with you guys. and
Yes,
some
yes.
help.
Call Charlene.
I will direct you to the route.
So a lot of the divisions, public health is one of the larger ones, and oversees a lot of different areas, including environmental health, going out to restaurant inspections, making sure those restaurants are cooking their food at the appropriate temperatures, and making sure that the food is safe that you're consuming. They also oversee the communicable diseases and infectious diseases, so making sure we're keeping the spread of infectious diseases like pertussis, measles, tuberculosis under control. and we have a whole team of nurses and physicians that work on that, keeping sexually transmitted infections under control and many other diseases, keeping them controlled so they're not spreading in the community. We also, so Charlene mentioned, you want to talk about your office that you?
Sure. So my unit is called the Prevention and Health Promotion Unit. So we focus on addressing Multnomah County's leading causes of death. So we do work. We have actually current funding, federally funded, to address youth violence prevention. We have a racial and ethnic health disparities grant addressing chronic disease within Multnomah County's Black and African immigrant communities. We do that work through 3 different strategy areas, so nutrition, breastfeeding, and the built environment, and then what we call 2 cross-cutting themes, which are social cohesion and economic development, right? So recognizing the power and influence of community and being connected and helping to support health. I don't know if you all have seen more recently, the Surgeon General released a couple of groundbreaking reports, one declaring gun violence as a public health issue. He also recently did another release around the impact of being parents in this generation and how it's affecting the mental health of our community. And another one last June where he spoke about the loneliness epidemic in America and how that is infecting and contributing to the chronic disease disparities that we work towards. So my work is really more on the preventative aspect of things, right? So we try to prevent. We do the work through what we refer to as the life course perspective. So looking at preconception health all throughout, right, to the end. I'm like, I can go on, there's a lot I can talk about. But I think that's just sort of the gist. So doing work around adolescent, doing work with community, really just recognizing that, we know the return on investment, right, that comes with prevention. And also I would be remiss to not speak to, right, the underfunding of public health, right? I think a lot of the frustration, honestly, I was talking to several of you before, we've seen, I've been in public health for more than 25 years now. There's always been cuts in public health, right? Always. The only time we ever had like surplus funding was COVID. And guess what happened after COVID? It's all gone. And then guess what happens though? It's all gone, and then there's budget cuts with it, right? There was actually a study that just happened where we partnered with the School of Public Health at PSU and saw that in terms of preventative services, we have 42%, right? So imagine that, and then with the compounded issues, right, and the complexity of those and trying to respond. So we're really focused on primary prevention, recognizing the power of collaboration. So we definitely do not do our work alone. We have community coalitions that we work with. We have community groups that we partner with. I think sort of specific to this and kind of getting the gist of your work, and I know I shared my card with you. We're happy to connect with you all around. So it's called Sept. So it stands for Crime Prevention Through Environmental Design. And it's where we have staff who are trained on working with community groups to do walk audits. And through those walk audits, you're able to assess how the built environment contributes to violence, right? We know also that if we're able to make improvement both in the built environment, it decreases crime and also has this ripple effect through our work. So under my leadership, we've been really intentional about rolling out through what we call the shared risk and protective factor, just knowing that an individual is so much more, right, than that one person, right? And the benefit of having a community is a protective factor. We also know that individuals, right, like yourself, stepping up to be peer mentors, right, to be mentors to young people in our community. A young person having a mentor or having one trusted adult in their life is a huge protective factor. So again, that's just some of the examples of some of the work that we're able to do. I'm happy to talk more, share my information. I try to respond to emails as quickly as I can. But yeah. Actually, I'll probably say the other thing lastly too within our unit is that we also, so under my authority, we also do the regulatory function around tobacco. We have about 752 licensed tobacco retailers within Multnomah County, and we have enforcement efforts that we do. working with individuals, 18 to 19-year-old, who goes in to test, right, the retailer's ability to ensure that their property carding not to sell tobacco products to individuals 21 and over, because that's one of our more recent policies that we've been able to do. So with that, I'll turn it over to my colleagues. I'm happy to talk more with you all.
Okay, I guess it's left me. I work in the behavioral health division. I work in the addiction portion of it, but we have in the behavioral health division, I don't know if you heard of jail diversion, and it's where people with mental health, they get diverted and they get services when they come out of the hospital. So, and it's called CMHP, and then we have also the crisis line. That's part of Multnomah County, the crisis line. So if there's a crisis, you call that. We have civil commitment, where people who police deem a risk to harm to themselves or other people in the community, they go out and they do an assessment, and then people are put on a 72-hour hold and be assessed until they come out of the hospital. And then we have children services where we do school-based mental health. So our services are in a lot of the schools in the area. And then there's me. And then we have the Office of Consumer Engagement. I forgot that. And so what they do is they go out and promote the lived experience, make sure that policies are hearing the voices of people with lived experiences. And then there's what I do. So primarily what my role is that I don't know if you know this, but anyone can get treatment services in the state of Oregon, whether you have insurance or not. So that sort of responsibility is given to the counties for people who are underinsured or uninsured. And so if you were like working poor and you had an insurance that your deductible was $1,500 or something and you couldn't pay for that and you met 200% poverty, you could come to the county and get your treatment paid for. And so the state gives the county in my division about $16 million to fund services for individuals who are underinsured or uninsured for any treatment services that they need. But also it provides gap for services. So we fund a lot of recovery services, housing services, and this year our budget is about $23 million to support those services. So I have a bunch of contract, we contract with over 43 providers in the community for these particular services. And then also I'm responsible for prevention services. So it's substance use prevention services as well as gambling prevention. And then also we provide gambling treatment. So anyone with a gambling problem in the state, in this county or any state or any county can get gambling treatment services free of charge through the county. And we have providers that we fund as well. And the state lottery commission gives the county funds to sort of fund those services. And then the other one, we also under my portfolio in prevention is suicide prevention. So we have a suicide prevention, and we work with a coalition that focuses on the Black population because the suicide rates for those individuals is higher in this county. But we provide suicide prevention for any person in this county, and education and any type of prevention work. We do post-vention work for youth. So when someone commits suicide, there's work that happens after the suicide that goes out so that we can learn from those and try to prevent them in the future. And then currently what I'm doing is working on deflection. I know y'all probably heard that term before. I was telling, I've been up since 4 o'clock in the morning. I've been up 4 o'clock this morning because there's so much to do and my brain got to race. I don't know if y'all have this experience, like you have so much to do and then you sleep really hard and you wake up and your brain got 20 things and you can't sleep and you try to go back, you get up and just go to work. So I had that experience, so hopefully I'm making some sense. But so we're working on deflection, which is a law that was implemented through Measure 11. So they changed some of the rules of Measure 11 around the criminalization of small amounts of drugs. And so Multnomah County set up a deflection program. And so I'm one of the people who's setting up the deflection center and some of the deflection program. And so that's what I'm doing now.
Do you know about the one coming from out of state?
Yeah, Turnhouse, they're here.
Uh-huh.
Yeah, so they're the one there. So we're working with them to set.
Are they fully staffed? Did they come with staff or what did they?
Yeah, So I can answer that question. So I just got off a call with the chair. They're actually, they're somewhat fully staffed. I think they're lacking one individual, right, that they need to do for 12 hours. It's gonna start off as 12 hours, but there's some training and some other sort of things that need to happen before we can actually open up the center, as well as that we're working with the neighbors in the neighborhood to work on a good neighbor agreement so that we're
So are they using the facility that the county's already set up?
they're going to be going into the facility that's being worked on.
Okay.
It's so interesting. I was just there today. I went there when we got the building. I was like, oh my God, what are we going to do with this? Right? I was like a little nervous. And then I went there today and I was blown away. It's trauma informed. It's beautiful. And I was like, they got this thing like done like pretty quickly. So I'm really happy what I saw today. They're still working on it because there's a phase 2 where they're going to put sober services and some other services that they're going to be working on. So they still have to do that part of it. But the other part is I was pretty impressed.
So is it the end of October, or when are they gonna open?
So
up?
the date is October the 15th.
Okay.
If we get it done before that, but October the 15th is the date that the chair put out.
Okay.
I knew that deflection. I was like, I should wait to the last and say deflection.
Okay, in your estimation, what would you consider the 3 leading causes of injury, illness, and death in Multnomah County?
Oh, yeah, I mean, I can answer that. I mean, obviously, heart disease is still number 1 nationwide and here in Multnomah County. Cancer is probably number 2. Lower respiratory infections like pneumonias, and probably 3 unintentional injuries are growing, and those are like overdoses, unintentional overdoses. We had 768 fentanyl overdoses last year, which is the highest we've had, and I want to take a moment to just take that number in because it's quite high, and
There were 768 deaths or overdoses.
Overdose deaths. Yeah, that were related to fentanyl.
What's the average, what's the age gap, or what's the age range in those?
Yeah. Well, unfortunately, there were small children that got into fentanyl. Left out that were quite young, as young as 2 years old. And then all the way up into the 70s, 80s, as well. But each one of those people, represents our neighbors, our loved ones, our friends, our family members, and so, we want to make sure that any work that we do is really centered on trying to help people who are struggling with addiction be able to get into recovery and live lives that are productive and don't lead down that road of overdoses and death. So I can tell you a little bit about how we sort of like framed that, and we have an overdose prevention and response plan that we've released at the county in February that kind of documents sort of the trajectory of how, the different steps along the way of different interventions that we're
Do
trying
the
to
city and county parallel on these, or do they both go in their own directions, or
the city doesn't have a health department, so as the county health department, we are sort of the health authority, the local public health authority for the area.
I mean, there's some coordination depending on what, right, but we have respective lanes to be in.
Well, you spoke about smoking cessation. I saw a big ad blitz for a long time about Smoke-Free Oregon, I think it is, and then they all went away. Are you familiar with this organization?
Yeah, so it's the state campaign.
Oh, okay.
It's
Is there
still
a plan?
happening.
Is there eventual plan just a ban on smoking or ban on tobacco, or is that the net goal?
Is that a recommendation you're going to suggest for us as a community member? So what I will say to that question is that about 2 years ago, the County Board of Commissioners did vote on banning the sales of flavor products in Multnomah County. That is currently being challenged.
Court
We
cases,
remain
yeah.
optimistic on the outcome of it. And there's other things.
Why, you guys, all 3 of you are talking about drugs, right?
Absolutely.
One way or another. Well, why don't they shut down the drug houses, the pot shops. And it seemed like every time I turn around, I'm seeing a new pot shop go in. Well, the last meeting I was here, the lady says, well, it's small business. And I says, yeah, but you're taking a mom and pop store, going out of business and throwing a pot shop in there. And you guys are all on this drug business, and the state is, and the county and everybody is absorbing all this drug crap, and a lot of it is the homeless, a lot of it, and I don't understand, you keep wanting money to take care of the drugs, but you don't get rid of the problem.
I mean, I can say there's liquor stores, there's alcohol. I mean, it depends on what you want to define drug as, right? I mean, yeah, there's marijuana stores that sell cannabis, there's alcohol stores. You know, all of these have an effect on people, on families, on communities.
Now, I understand that the Oregon Liquor Control Commission controls the marijuana shops. Is this true?
Can't comment on that. Not sure.
I'll let you go, and then I'll say what I was going to say.
So I think one of the ways I want to just respond to the question, I hear your frustration. I'll say as a public health professional, we have the same concerns, right? But what legalized the sale of cannabis in Multnomah County was the voters, right? So it was out of our control in our lane. And now that it's legal, right, we're like looking at different public health measures to take to protect the health of the county. So I just want to say that. The legalization of marijuana was not a public health decision. It was the voters of Oregon, right, that did it.
Was that a poor decision?
That's a very complicated question. Would you like me to respond to that as a public health professional, right? I mean, it's definitely it is and continues to create a multitude of complexity and challenges for us, right? Recently, a study came out that spoke about people now are using cannabis on a daily basis.
Yes.
More so than they are consuming alcohol.
And they're driving.
So poor decision, yes or no? By the voters?
I don't, I feel like it's a judgment thing saying that, right? Is there a better decision that we could have made? Absolutely, right? I think some of the intent around the legalization of marijuana, right, was part of the war on drugs, the over-incarceration of people, right? So again, it's complicated. I'm just not going to say it's a poor decision because I think there's so much more in it. Now, can we do better, right, to regulate? Can we put different guardrails up, right? We can.
Well, you've got medical marijuana and you've got recreational. And so we've got recreational marijuana stores almost on every block. Exaggeration, but
Feels like it.
So, again, I love that recommendation. Part of what I'm hearing you say, actually, and I know I'm being recorded, and I'm in a public space, so I'm going to say that. We're actually doing some work around that, right? Where we are currently working, one of our grants that we have, we're looking at the alcohol, cannabis, food desert, looking at traffic fatality and violence density in the county. We know that there are certain parts in Multnomah County where community members have greater access to alcohol, tobacco, and cannabis than they do grocery stores or parks, right? So that's part of what we're doing, because part of it, in order for us to do something as public health, we need the data, right, to inform and help us to take the next steps that we know we need to take.
And I'm guessing in those areas you've got more crashes, more fatal crashes, more everything.
So you want to come and work with me?
No, I'm just,
I mean, it does, right? We see it, it overlaps, it overlays, absolutely.
And so, would the county do something to address that concentration? I mean, can you guys break that up?
I'm like, we can, right? But again, there's rules that's working, right? There's steps to take to get to, right? To get to it. And part of our first step is the data, right? So thereafter, then we're able to research and determine and do like a feasibility study on like what's the best route and strategy for that. But you're asking all the right questions. I love this because this is saying I had conversations with a group of people and these are some of the recommendations.
So I have a question that it sort of reminds me of something that I read, and it was about, and it's kind of tying together a little bit, you mentioned about the loneliness epidemic as well. And I read somewhere that the opposite of addiction isn't sobriety but connection. And thinking about all, I mean, we always seem to think about fentanyl when we talk about addiction, but I mean, is there some kind of ability to interconnect? And I love also the fact that you are talking about the built environment. I just recently did a course on risk terrain modeling. I don't know if you've heard of it, but it's kind of a little bit of that kind of thing. But I'm just curious, like, so you can't legislate your way out of loneliness or addiction.
Yes, so I agree, right? So honestly, there's so much happening. I would love to just for you different things. So I'll just give an example of one effort that we have that's been happening down in East Multnomah County, of a designated food desert. Actually, I don't know if y'all know, they were actually in the New York Times this week, noting that Rockwood is a food desert. And we've been partnering with community-based organizations since June 27th. So literally every Sunday I've been out there, except for the 1 month I was off on vacation, from 1 to 5, where we have converted the East County Courthouse into a farmer's market, right? We have, I mean, it's like, I just tell stuff, I'm like, it's such a beautiful space, right? Because we have people from different countries around the world, right, who now call Multnomah County home, who used to be farmers and growers in their respective countries, and they're growing, and that market allows them to do that. And I say that with them too, because one of them told me, they started like, I don't speak English. I'm like, it's fine, let's just talk, right? Because I'm like, I want to hear directly from people. And he said, this is so good for my soul, right? That's one effort that we do. We also have been doing a series of events called Reclaiming Black Joy. And it's really a violence prevention effort, right? And if you get to know me, I don't leave from a place of deficit. And it was really in response to a shooting that happened in the Dawson Park, where they literally had like 7 to 8 shootings during that period, like 4 to 5 different murders. Community members reached out like, we need the health department to do something. And in the middle of the night, came up with the proposal, and we've been figuring out and funding that, right? And while the event says Reclaiming Black Joy, it's a space where you literally see people from all walks of life, race, and ethnicity in. And it's literally celebrating, building community. We've been doing 3 and 4 a year. People are like, how come you don't do this weekly? I'm like, this is a lot of work, right? So I just wanted to share that, those are examples of things that we're doing as a health department. And then we also fund, right, and support and partner with other community-based organizations who are doing similar work to build community. And to your point, I mean, I cannot emphasize more the power of connection, right? And especially that emphasis on healthy connection, and especially for our young people. We're seeing things around like bowling and ice, right? Connection is so, so, so powerful.
But I want to speak to what you said, and it's powerful, and Janie probably going to speak about this. So I know when the election rolled out, there was a lot of negative things, right? Just, because people, they want to clean up the city. I'm a citizen, I'm a community member, and I see things. But there's been a few incidents where people had thought that like when people was engaged, they would just sort of not get the help, right? And one of my people went to court where because one of the things the police can do now, if we don't serve, if they can basically arrest a person and then tell them you got to come back the next day to show up in court. So of course everyone was like, oh yeah, they ain't coming to court. But they ain't coming. And one of my coordinators go to court, and 2 of the people came back to court, and the judge said, I am surprised by that. And one of the people who was speaking, one of the people who came back, basically was sharing about like one of the things that's happening is that you're getting people out of isolation. See, once upon a time, they were sitting in the tent of the law, and no one was talking to them. No one was saying anything to them. We had a fragmented system about how you engage people. Addiction is an isolated disease. Like, and most people who are in recovery would tell you that when you're in your addiction, you feel alone. You feel by yourself. You feel a lot of shame, a lot of guilt. No one cares about you. There's a lot of stigma that comes along with being in addiction. We have peer service, and people know how to engage people and know how to talk to people and know how to respect people, right? And so that brings people out of isolation where they feel a sense of hope. And I know people think this is a woo-woo word, but there's something magical about the idea of hope. If you give people the possibility that could be something different, that's something magical about that in an addiction world. And so I think where, we get to see all the negative things that we see on TV about process, things not, hiccups and things like that, there is some hope happening for people. And I think the more we go, a year from now, I think we would see more and more people getting services. And one of the other things I was going to say, I've been doing this work for come January, will be my 33rd year. Drugs have changed from what they used to be. Mm-hmm. They're way more powerful. The way they make drugs today is totally different. And so it's affecting individuals way different than what it was back. Even marijuana is totally different from when I was smoking. I probably get messed up now, but I'm just saying the drugs are different. Everything is different. And so the individuals who are using are more impaired. It's going to take a longer time for motivation to happen. We need to continue to engage them, not give up on them. And I think that's what we are trying to develop, is a system of not giving up on people that you see. There's many people you see out on the streets, they're getting better. They don't tell you those stories. They are getting better. So I just want to leave you with that. And yes, you're going to see negative things and things that go right, but there are people getting better. Is it as many as we need? No. But they are. So just hold on to that magic, and maybe a year from now we'll be better.
I'd love to share a little story, if I can,
about
absolutely. A patient that I've been seeing for the past few years. She's a woman who was struggling with addiction, heroin, fentanyl, and also living with HIV. And she was bouncing around, lost her home, living on the sidewalks, just kind of getting where she could. And she started to come in to see me in clinic because she would have these withdrawals from fentanyl. And so she wanted to try and get on some medication to help her out. And so I worked with her over a period of probably 2 to 3 months where she would come in each week to see me in clinic, and we tried to get her on medications, try to help her out. And sometimes I wouldn't see her again for a couple of weeks. She'd just kind of fall in with the wrong crowd again and really just fall back into her old ways. And she wasn't taking her HIV medication, so her viral load was very high, and it's causing her CD4 count to go down, so she was getting all these kinds of infections. Had thrush in her mouth, couldn't swallow because she had this, fungus, growing in her throat. And so I would see her occasionally. She'd come back, and I would just try and put lots of arms around her. We tried to get her lots of different services so that we could try and help her out. And we worked with an organization called Cascade AIDS Project, and they have a house called Our House. And she was able to get housing through them. It's a place in Southeast where people who are living with HIV can get indoors, right? Because we were realizing that no matter what we were kind of trying to do, get her to take medications or trying to get her in programs, nothing was really working because she didn't really have a place she could come home to and feel stable in. And that was really the one piece. Once we got that piece, we were able to start getting medications. I would do home visits. I would just go out to Our House and I would talk with her. I'd do an exam. I would get her medications, and she had nurses there that could give her medications. And so she got back on her HIV medications. She got on Suboxone for her addiction, so she could keep those cravings under control and not use. And I just saw her last week in clinic, and every time I see her now, she gives me this big old hug as soon as I walk in the door, because she says, "Thank you, Dr. Bruno. You saved my life. Your team saved my life, because I would not be alive right now if y'all weren't able to help me kind of get in, get housing, get back on my medications." And she used to be so skinny, as thin as a rail, right? She's put on a little weight. She's like, I know I'm gaining weight. I'm like, no, it's good weight. It's a good kind. You need a little weight on your bones. But it's just so amazing to see the transformation people can get once they get plugged in and get a little bit of extra support and get that stable place to live. And so I like to think about her a lot, I talk about her a lot because I keep her really close to my heart because I really think about people like hers. You know, we have these amazing stories for people that actually do, that the system can work for people when we can put enough arms around people and help people out.
And the system is working for some people.
Yes.
It is.
Yeah.
Well, it's kind of a broad question, but is anybody anywhere, are you aware of, trying to have any kind of insight into what is the root cause in our society, or what is wrong with why seems like a greater percentage of our population is either drunk or stoned or high or whatever?
Well,
I mean, why are people so unhappy in life that they turn to this?
Yeah, I mean,
You know what? In the past 50 years or generation or whatever.
Sure.
Can I add on to that real quick?
Go.
So, are you guys working with the education department at all to address and to teach and to whatever you want to call it, so
We work
that
on Multnomah Education School District.
so that we give them hope and we give them the tools they need?
What age are you working with?
So we've worked through Multnomah Education School District and then work with all young people, right?
I was thinking started
So
kindergarten.
yeah, so our traditional, I was mentioning to you, our prevention work has been on middle school, and now we have a request to go younger.
I would go younger.
And so, what do you
So-
guys? What are the tools that you're trying to provide? What are you educating them with? How are we stopping this epidemic? Because it is an epidemic.
It is. Do you want to? I mean, I can.
We've
do a
got
little-
these-
It's
Phones. We've got the social media. We've got more potent drugs across the board. The more plentiful. This is insane, and our kids and our nation is insane.
Can I just say something to that though? Like I love that you are, I mean, there has to be work in schools, but you know, schools are actually there to teach. Like, what are parents doing? And it gets me very frustrated actually when we think, oh well, there's a problem, we got sex education. Oh, schools have to teach that. Like, what are parents doing?
I
And
agree
where
with
does
you,
that
but
responsibility?
the schools have for 8 hours a day.
Of course. Well then, but then they're in school for less time than they're at home. And I think that also a trend that I have observed is that parents are more time poor. And sometimes it's because of necessity. I mean, when I moved here from New Zealand, I had to work 3 jobs. I wasn't around for my son the way I had been in New Zealand when I was in a relationship with his dad, and you know, we had more people. But the fact is, if you're not connected to your children, you know, it's so easy to not. If I found myself when I was working 3 jobs, I wasn't as firm or consistent with my son because I felt so guilty. I got over that pretty quickly. But that's just what I feel, is that it's got to be parenting.
Yeah, there's a lot of factors that lead to it. I know we're coming up on time. We take a little extra time. I'll leave you with this one kind of analogy that I like to talk about when we talk about all the different factors that lead somebody to, you know, starting drug use or getting involved in the wrong crowd or whatever, gang or violence or gun violence or anything like that. So we have to think about the river of addiction is really kind of the analogy I like to point to, right? Because what happens if somebody falls in the river of addiction because they don't have a good home life, or they've endured trauma, sexual or physical abuse as a child, or they have something that's happened to them, we call them adverse childhood events, that happened to them early on and they didn't have the proper coping skills to deal with, that leads them to turning to other things like drugs or sex or any kind of addictive thing in their life. And so if they fall into that river, right, we want to try and prevent that in the first place. So we try to put up some fences along the side of the rivers to try and prevent that, help people with coping skills, starting early to try and prevent that. Work with law enforcement to try and get the drugs off the street. Right, all of these things are kind of primary prevention. Once somebody's fallen in that river, though, they may come up to a waterfall and they may actually fall over that waterfall and overdose. Right, and if they've fallen off that waterfall and they're overdosing, they're drowning at the bottom, we have to save their life. And if somebody's overdosing on fentanyl, it means we can give them Narcan, give them naloxone, and spray it up their nose, and reverse that overdose and bring them back, right? But if they're drowning and we're trying to save their life, we can throw in that life preserver, but it really is a life preserver that's made out of paper. It's going to dissolve in 30 minutes when that medication wears off. So really we have to try and prevent people from falling off that waterfall as well. So we have to put up some nets on that waterfall, and that's really trying to prevent people from dying, and that's methadone, Suboxone, safe needles. It's all the harm reduction that we try to do to try and prevent people from overdosing. And then, so we kind of have to work on all three levels, really. Primary, secondary, tertiary prevention. But really it's back, all the way upstream, putting those fences up. That's the early prevention work that Charlene and her team are doing to really try to ensure that we're helping people in the community feel supported, less isolated, and bringing healthy skills to bear. So we work along that whole spectrum, all along the river. We're sitting there, we're trying to build those fences, build those nets, give people life preservers, save lives, and we're trying to do it throughout the entire county, hundreds of thousands of people at a time. So it's really an honor to talk with you tonight. We really want to stay in touch. We want to hear from you. We want to make sure that you're feeling like supported by your health department. So we want to turn it over to our friends at MHAO here, because I know they have some really amazing things they're doing as well.
Yes. And now we can give contact info.
Yes.
Yeah, we would love to have you guys back, because it's a lot. It's really important. You guys have a lot of information, and we've got a lot of questions.
Yeah.
So if you guys can come back maybe next year, that'd be awesome.
Great community.
All right, thank you.
Well, and that was important stuff, and so I'm glad the time was taken. And I want to do things a little differently. Hi to some friends that this is my 4th time here, and so there's a lot of familiar faces and some new ones. I'm Janie Gullikson. I am a woman in long-term recovery, and for me that means that I have not used drugs, alcohol, smoked cigarettes. That's part of my story, or committed crime or been convicted of a crime since June 9th of 2001. And so for me that has afforded me to be a homeowner in my community and grandmother of 20 grandkids who have never seen Granny drink or use, who are that next generation, who have heard, as appropriate, Granny's story. And
Are you training them young?
Training them young.
Good.
Yeah.
No smoking, no drinking, no drugs.
There we are. And I have my oldest grandson's almost 16. I can't say he hasn't tried stuff, but he's got a solid enough foundation that after trying it, that was good enough for him, and here we are. And I don't know if that's going to be all 20 grandkids' story, but guess what? They're going to have a granny who's ready to support them, and they'll know how to connect them if that time comes. So I want to introduce my coworkers and people who I admire and respect, and we surround ourselves. When we're smart, we surround ourselves with people who are smarter than we are, and I've done that in spades with an organization of almost 200 people who have stories similar to mine. I won't tell anybody else's story, but I'd like to introduce them and then share how we are going to be building community and be a part of this community, if we have time. If not, well, what's been said tonight was what needed to be said.
So I'm Melissa Bishop. I am the Senior Housing and Facilities Director at Mental Health Addiction Association. Also a person in long-term recovery. I have almost 17 years clean. Have been living in Portland all of my life. Really it's critical and important for me to get back to the community that I've taken from, and so being able to sit here today as somebody who fights for my community and for the people that are suffering and struggling, I'm just really excited to be here.
I'm John Carp-Evans. I'm the Deputy Director at MHAO, also from the recovery. I've been clean since 11/20/2002, and I've worked in this field for the better part of 15 years. I was a peer mentor for Bridges to Change years ago doing prison transition. I worked for Central City Concern for over 8 years, and then I was at the health department in behavioral health most recently before going to MHAO about 1.5 years ago.
And my name is Tarra McCarthy. I am also a person in long-term recovery from drugs and alcohol. I'll celebrate 7 years in March. I am also a single mama to a little boy who just turned 5 and who has never seen me use drugs or alcohol, who I am also having those age-appropriate conversations with already, because that's important, right? I've learned all of these coping mechanisms myself, and I'm able to give that back to my community, my child, the people that I encounter, and I just echo what Melissa said. It's really my life's work and passion to be able to take what I have learned and some of the darkest, hardest moments of my entire life and use that to connect with other people and let them know that I've been there, I understand you, I see you because I am you, and I can help you through that. So.
I had a card I gave you.
You did.
You want to try some of those?
I mean, I'm happy to. I don't think, not to say I wouldn't, I'm happy to respond to these, and if the group consensus is these are the things you want answered, that's great. I'd like to tell you.
You can ask.
I mean,
questions?
Yeah, do you have any questions so far? I mean, I think we've shared a little bit.
I feel like I stepped on his question to the county people. Yeah, maybe you guys could answer that. What, in your guys' experience, is the best preventative for kids, adolescents, adults to going down the path of drugs, addiction, mental health, etc.? What would you guys want to see from parents, education? How do we stop the start of addiction? What do you guys recommend on that?
What I was asking is what do we know? Does anybody know? Why are people so unhappy? To begin with, before the drugs and alcohol even come on, what is wrong in our society? I mean, some people blame capitalism, some people whatever, but what is the root cause before it even starts?
I think there's so many factors, right? I mean, I don't think we could say it's this or it's that. It's poverty. It's broken, homes. It's so many things. Okay. It's like it's mental health. It's like generational trauma. There's so many things that are feeding into
it's poverty, it's racism, right? It's a lot.
It's all the things, and so you can't say it's one thing.
But most of the things are new.
But none of them are new. But I think they're snowballing, right? I think they're snowballing, and people are getting more desperate, and their drugs are more easier to get, and it's more prevalent, and it's becoming an easier solution than it used to be, right? It used to be, I'm going to go drink a beer. Now it's like, I'm going to go have a gun and some fentanyl, or I'm going to do whatever. So things have changed, right? The world has changed. And so there's not one reason, and that's why we have to have a multifaceted solution to the problem. Not one thing's going to fix it. Deflection ain't going to fix it. Treatment ain't going to fix it. I mean, there's so many, it's going to take all things and everybody on board. It's going to take every community member to be a part of the solution. And I in my community, I get frustrated, right? I get frustrated at the things that I see, but I'm a part of the solution. And so I think we have to figure out what is our part, what can we do to help, and know that we're all a part of the solution. And so there's no perfect answer. I would love if there was an answer.
I started smoking pot in 1970 because I thought I was going to get my butt shot off in the NAM, so I might as well have a good time in the meantime. 27 years later, I turned it off. I quit.
That's
yeah, it's something to take its place. That's a story for a lot of Vietnam vets, and actually there was a study done about. Because that was a question. How did so many use heroin or other substances and come back and quit?
Yeah.
And then how did others?
I never went. I did not get drafted, but I mean, I'm just saying. I thought it was inevitable at the time, so I don't want no stolen valor here.
Oh. But I mean, that's still that brought up that study. That's something that you can read. And one of them, we heard it from public health, from our community partners, from each other. Community is a protective factor. loneliness is an epidemic. The opposite of addiction is connection. So,
You know,
that's
I think another thing just to say too, right, and just building on that, it's helping and supporting that young mom that you know, right? It's helping that young mom to be able to breastfeed, right? Because we know that breastfeeding and that mom and child bonding is amazing and phenomenal, right? Helping mom and parents, right, to experience paid family leave. That's huge. I feel like one of the industrialized nations where we don't provide that. But it's huge in terms of parent-child connectedness and bonding, right? It's, Dr. Bruno shared that story. Housing is healthcare, right? So as taxpayers understanding, part of getting people to heal, it is providing housing. It is making sure they have the basic needs met, right? Because all of these, so it's in public health what we call social determinants of health. So, right, so food, shelter, access to transportation, utilities, right? Like all these different all these things together impacts individuals' health. And then you think about that individual and how it rolls out into community, right? And I think sometimes we, similarly, we all get frustrated at what we see in our neighborhoods, right? But it's how do we humanize what we're seeing? How do we instill that hope? How do we be solution focused? And really understand, I cannot underscore the power of connection. It is so, so powerful. Like our young people, helping them to be connected and disconnected from the phones.
Well, I think we see it now more than ever. We're a very individualistic society. And when you think about like 1950s and 60s and other countries where it's a collective society. The neighbors are helping. If there's a single mom, if there's a widowed mom, like the neighbors are, so we're all helping each other. We're working together as one unit to make sure that we're all okay. And we're not doing that necessarily today. We're not seeing that.
It's us versus them, right? It's not that concept of it takes a village. It's like you did that to yourself, so you figure it out.
I think the other thing to keep in mind also is that we could come up with the best solution in this room. Tomorrow, nothing's going to look different. Right? Next week, nothing's going to look different. Next year, things might not look different, right? And you can talk to folks from the county, you can talk to anyone at this table. We can tell you stories every day of people recovering, of things happening, but that's 5 of us, right? These things are happening. They're happening at, somewhat of a large scale, but it's going to take years and years and years to change this community, right? And it didn't take 2 days to get here, right? This is years and years and years to get to this situation. Even with the best solution, the most money, the most housing, all these things that we don't have, it's going to take time to build that infrastructure, time to design that programming, and time to get people to buy in. So we can start to make strides, we can develop programs, we can start all these things, but the long-term result is going to be a long time till we see that payoff in our community.
You guys talk about community and this and that. Without personal responsibility in making better choices, and believing that housing is healing, if you put someone with drug addiction or mental health into a house, what are they going to do to that house?
I can tell you what I did when I got a house.
And you were on drugs?
I was on drugs,
okay.
Yeah. So I have 7 years in recovery. I'm a recovering heroin addict. We heard from Close Street. I was in MCDC, probably when you were overseeing it. I went through the Close Street program. It was my very first time in really, really big trouble, and I was able to go to treatment with an ankle monitor on my ankle, and through that program, and I completed my treatment, and then I moved into transitional housing, and Melissa was there at that time. And I got to start building these building blocks, right? I had to start remembering who I really am.
So you had consequences, it sounds like. You had an ankle monitor, so you went through the court system?
Sure, yes.
And Janie, I'm guessing you did as well?
over and over. And over
so there's personal responsibility attached to.
It wasn't the answer, though, I'll tell you that.
It wasn't the answer, but it got you.
And what would have happened if I, as a young person, had met somebody at the point in my life, right, if there was prevention going on, if those conversations were happening within my family system, because this is a genetic thing, 50% of it is genetics, the other 50% is the environment, right? If those conversations were happening in the home, if I didn't have that childhood trauma that took place, or if I had gotten to the place where then I was 14, 15, 16, and I had started experimenting, and at that point I connected with a peer who was able to connect with me. I was able to lower my barriers and listen to this person because they weren't a counselor talking down at me. They were someone on my same level saying, I see you, I know you because we are the same. What would have happened then if it would have been caught at that place? I wouldn't be, their taxpayers wouldn't have been paying all of those dollars for me to stay at MCDC and go through Close Street because it would have been stopped at that point. And so what the whole point of this is we need a multifaceted approach with all of these different streams, all of the cooperation from community partners, people like yourself, all coming together and unifying and say, yes, this is problematic, this is an epidemic, absolutely, and we all play a part in that. What is my part? We know what our part is in that, and we do that very well. The county is doing amazing work, and we're just blessed that you guys are asking these questions and hopefully wanting to also be in the solution with us. And like John said, I wish I could snap my finger. I was always looking for a magic pill, a magic solution. That doesn't exist. It takes time and patience and effort.
But I think also to answer your question, I think what you're getting at, so let's because I think that this is what happened. This is a belief what happens when people use drugs. I think most people believe if a person uses drugs, if you put them in a house and they got mental health, they're gonna burn down and destroy the house, right? That's the sort of belief, and that does.
Well, are there studies? Are there studies or antidote that says that?
Yeah, no, I'm gonna tell you. You're right. If you put someone with an addiction and someone with mental health without supportive services, I guarantee you that happens. Mm-hmm. But I can tell you in the Portland metro area, there's hundreds. I'm telling you, I counted, we counted what we fund. There's over 600 recovery supportive housing beds where people with addiction problems go in and they don't destroy their property because they have supportive services. Now, absent of that, what you're talking about, the results will actually be that. So I think we have to sort of ensure that when we have people with mental health and substance use, that you have the right supportive services so those things don't happen.
Absolutely.
So I just wanted to add that.
No, 100%.
Okay.
Yeah.
Because if someone doesn't think that losing my 5 children wasn't consequences enough, and I didn't lose them to child welfare, I lost them because I couldn't take care of them. Thank goodness my parents could for me, and that's the short version of the story. I lost jobs, I lost houses, I lost my own personal hygiene. People in the drug world who knew me would walk up to me and say, "What's wrong with you? Like, don't give Janie any drugs." Those were consequences. So jail for me on the 5-year installment plan, that was a sandwich, a nap, and a way to, at the time, without being connected to services, and you've probably seen well, I was going to figure out how to do it better. Not quit, but how could I do it and not go crazy? Or how could I do it? Oh, you diagnosed me with schizophrenia? Great, I'm on antipsychotics. I can go out and do my drugs and I won't go crazy. I didn't have anybody to show me anything different. But what I did have, when there was a woman who had been where I had been, she was me, 8 years ahead of me, came back into that prison and said, I've been where you are. And she held up her mugshots, and you would not have known that that was the woman standing in front of me. And she's still in our community doing the work today. But
you were sober.
It was that.
You were sober when she.
But I didn't have hope. It didn't matter if I was sober. I was planning my next, like how I was going to do it more successfully. Until that moment when she told me her story, I got hope. And we've heard that time. I was just like, oh my God, people, you get it. Because change isn't possible without hope.
And services.
And then you need the services,
Yeah, I mean,
but I'm not gonna use the services if I have no hope that I'm gonna change or that my circumstances can be better. And so we are creating a center that's gonna be on 89th and Powell. Our doors open on December, well, for the new year.
We're shooting for
January.
January.
We get the keys, but that's
December
what,
27th.
that's what we're gonna open our doors to the community. Whether you pull up in a BMW or you walk in off the street, we're gonna make that connection with you, and we're not gonna just say, oh, we don't do that. We don't provide treatment. We're not the shelter. We're not the medical provider.
Not a day center.
And we're not a day center, but we're gonna connect you to whatever it is you are seeking. And we're gonna go with you, and then we're gonna, if you want us, we'll be there at the door when you get out. Or we'll stay with you if you have to go access healthcare across the street at Rosewood Clinic. And
What is going to be the key to building out the services that Oregon needs?
Great question.
Get rid of the drug.
Well, so I moved here from the East Coast, and it's been, since I've been here, Oregon has underinvested. Even if you, what I'm saying is that a commitment to be one thing, of investing in the right type of services. And then the other thing too, you got to build the right services. Like, it's not just really about treatment services, but people, especially in this community, housing is a big issue. When people leave those services, they often need a place to go if you're going to maintain someone to sort of have that hope. So if you don't have those things, then you just invested all that money and send it back to the street. That's a poor investment. So I think it's going to have to be a continuum of investments, and maybe you don't, I keep saying, I'm not being recorded. I don't want to say it anyway.
You are.
But people, I see these reports that go out about, like, we need 1,300 residential beds and all those. But just know that those acute beds are temporary. Like, people are going to leave, but where do they go to? If you invested, and those beds cost a lot of money to be in them. If you're going to make that investment, you better have the next step. So I always say, if you build 100 residential beds, you better build 100 transitional beds, and then long-term housing to accommodate, because most people are poor, and I think people talked about, they have trauma, some have mental health, they have a lot of issues that have come from addiction that it's going to probably take them 2 to 3 years to sort of maintain and to get back well, so they become productive members of society.
And in those 2 or 3 years, they're going to need continuing service.
Some type of service. Most of them go back to work, and some save money. The most successful programs that we have in our portfolio is when people have supported housing while they getting peer services, whatever, and then someone is checking up on them, because it's easy for people to sort of go back, but they still continue to have connection while they get into sort of in whatever recovery community they decide they want to sort of help them maintain that. They need constant connection, someone to follow up. You need that for a period of time.
When will Multnomah County have that?
Multnomah County. I think people put a lot. Janie just said she's providing a continuum. I think I like what Melissa said.
I'm not saying Multnomah County. The county. When can the citizens expect to have these services in place for the 10,000 people that need it, that are just unsheltered?
So what I would say, I have no one can answer that. I bet you if you ask them. But I like what Melissa said. It's going to take a collective effort for us to sort of have a collective, for the first time, really for us all to get together, and knowing that there's many different pathways for people who are seeking these services. Like, the people have unique experiences, they have unique challenges, and we have to collectively set up a system for those unique challenges. And so, to get to your answer, I don't think we know, because our system is so broken and fragmented. I think that's...
And we have a new city council coming through, we have new elected commissioners. So make sure you vote and read the booklet and vote for the folks that you feel like have good ideas.
Well, here's the thing. You guys are talking all this rehab and stuff, which is great, I understand. But is there any way, I mean, when they first started selling marijuana, okay, it was great. Then it got a little worse and a little worse, just like your river. You're going down the river, it's get worse and worse and worse. Let's put a dam up there.
Yeah.
Let's go to Congress and say, hey, we want to stop the selling of marijuana. There is no health reason why we should have it.
We voted for it.
I know, well, that's what I say, go to Congress, let's reverse that. Because it's gotten out of hand from what they expected back 10 years ago, let's say.
I was gonna say, so that's a state issue, right? So it's not federal.
It's a state issue.
So you gotta take it back to the
According to
voters.
federal law, marijuana is illegal.
But states have.
I guess what I'm trying to get at, this didn't just happen yesterday. This has been ongoing, and the system's broken. So, you know,
No, I totally get it.
Yeah.
The solution's gonna have to be ongoing too. Like, I wouldn't say there's an end date, right? Whatever the continuum of expansion ends up being, it's gonna be a continual process that's gonna have to expand forever.
well, that sounds horrible.
That's a reality.
Because what we've got is we've got a growing homeless population that is absolutely destroying neighborhoods and businesses. Businesses are leaving, people are leaving. I've lived in this city my entire life, 54 years. This has got to stop. We need a deadline. We need a date. Not that this is going to continue to expand. That's a crap answer.
Did you see?
And I'm not talking to you.
Did you see the?
I'm talking to the entire everybody.
Did you see that was a report that just came out, and I think last year that 21% of the household population got moved into permanent housing. So the number.
I saw that.
Yeah. So.
But do they have the services they need to be successful?
I was going to tell you, if you look at some of the houses that's being built, affordable housing, they actually are putting support services in those.
Yeah,
houses.
that's the key.
Yeah. So I think what you're going to move into. I think if we just give it some time, and I'm with you because I hear what you're saying, but I think over time, and I think we're in a crisis, and in crisis people look for instant results. I think it's going to take, I'd say a year from now, if we can't, hopefully you still here and I'm still here, we come back and we look at, has it gotten better? I'm sort of like, I'm hopeful in a year from now, with some of the policy changes and also some of the investments that's coming down, that we should see some changes. It won't be fixed. Will not be perfect.
Yeah, it'll never be fixed.
Yeah, but I think we should measure improvements. And I think it's sort of what John said, we continue to sort of build on our improvements to sort of enhance the services that we need and sort of the investments. I think it is a continuous, looking at data to move us to sort of what we need. So I think that's what, hopefully I'm not speaking.
Yeah, I mean, I think the biggest challenge right now is if you ask everyone around this room what we need, you probably get a different answer, right? If we look at the data and we build strategically, we're going to build the right services. But it's going to take the whole continuum. But depending on the business owner, the neighbor, the service provider, everyone's going to say this is what we need because this is what we know or what's affecting us.
Well, as far as the neighbors go and the businesses go, we need the homeless, the drugs, the mental ill, that entire thing to stop and stop being in front of our front doors and in front of our business front doors. That's what we need.
So
and I think we've got
vote for different people to make that happen. These folks can't solve it by themselves.
What's your name?
So I have a question. If it is your son that is doing that in front of the business down the street's doorway, what would you want us to do? And it's an authentic, that's a real question. What would you want us to do?
Well, what I would do, if it was my son, when I'd grab him by the hair, and I'd bring him home, and I'd first of all, hopefully it would never happen.
Probably 50 times, maybe 100. It didn't solve addiction.
Well, you've got to go to the underlying problem.
It's true.
Yeah. So whattever that is, that can vary, right?
Well, maybe people.
But what I know is that my neighborhood is 95% minority, low income, and we're being terrorized for years. Nothing's being solved, nothing's being done that we can see on our end.
I can hear you loud and clear,
Yeah.
because I know that I have the luxury, I live in, off Highway 213 in Beaver Creek. So, nobody's coming out there, there's nothing out there.
Well,
Except for on their way to Malala.
I mean, somebody's gonna
But I
move.
would be very frustrated if that were right outside my door, and I would feel scared, desperate, and want answers and solutions right now.
I'm moving
So
to
I
New
hear
Zealand.
you that too, with that too.
I mean, it's
But-
like, everybody's just gonna move out of Multnomah County, and Multnomah County is gonna look like Detroit and be dead. And I don't want that to happen, because Portland's a beautiful city.
It is.
Like thinking about the root causes as well, I mean, a number of people mentioned trauma, and I think that's the other thing, is that a lot of times the pain or, you know, whatever happens when, you know, sometimes you can kind of know, like, there's an unhappy house on your street, or, you know, maybe not now because we don't really know our neighbours. But, you know, I'm thinking back in the day when I was younger, you kind of knew, like, oh, you know, my friend's dad has a heavy hand, you know, or that woman is, like, wearing sunglasses, or whatever, or those, there's something weird about that family because they won't let their kids come and stay over, or have sleepovers at their house. And I feel like that's also part of it. We're talking about root causes, and it goes right back to, if you think, if you like that whole, if you see something, say something. But back when I was young, I'm 57. When I was young, we didn't talk about it. We didn't know where to go or report that kind of thing. But there are plenty of places now, and I feel like that's the other thing, is like if you sense something's a little off, or reach out and ask, like, because once people experience trauma, you know, you want to stop the pain. And that goes to suicide, or that goes to drugs, or that goes to whatever, just hating yourself. But happy people don't get themselves living on a footpath. I mean, they, you know, so that's just one of the things as well, that collective responsibility. When you think something is off, like, what can we do? Like, we're not intervening soon enough.
If I can give you one message of hope. 25 years ago when I first started this, there wasn't collaboration. Police made arrests, corrections was housed them, they got out of jail, you had a revolving door. Working in Close Street really opened my eyes to, as a member of that community, the need to collaborate, right? So there's more of that going on every level that you're even seeing here, where, and I can't speak for everybody, I don't know everybody's job, but like my folks, we don't just throw an ankle monitor on and say, go forth and do good, right? I mean, I wish that would work, that'd make my job a lot easier. But what we're seeing is, if I can get the person connected through the health department to the medicines they needed before they get released from jail. So they get released with that, with a treatment plan. Successful, more successful, right? Not everybody. So if I can work, and that's why we brought counseling staff into my office, is so that they get a needs assessment done once they come out and go on to supervision. And we start working with them. That's why I gave you folks my card. We start working with community partners that are going to be able to resonate with that person, so that they don't get that's just Sergeant VanHoute talking to me again. There's a partnership that's working there. So if I can give you one message of hope, what we're learning in this sector is the need to collaborate, the need to communicate between each other, the need to just not treat somebody as, oh, that's just an inmate. That's not it, that's a person. When they're out of custody, that's not an inmate, right? So we're better as a community if we collaborate and communicate, and we're learning that. It's been a slow process, but we're learning it. So if I can give you one message of hope, is there's more collaboration that's happening on every level here to try to look towards that solution than I've seen in 25 years working just at the Sheriff's Office.
Thank you, and thank all of you for joining us. The meeting is adjourned.
Yeah, good conversation.